Hello, I'm Renee Eckhart, a clinician from Cork Medical, and today we'll be reviewing our Cleanse Therapy. The Cleanse Therapy kit comes with two items. You would get the 60 ml syringe and our silicone port pad with the extra lumen that allows us to do a direct delivery of the prescribed fluid into the patient's wound bed. Cleanse Therapy can be used on both non-bridged and bridged wounds and typically is short-term. Now that our patient's dressing has been applied, we're ready to move on to the next step, which is applying the port pad. This patient has orders for Cleanse Therapy, so we'll be using a port pad that's similar to our general port pad, but it has an extra lumen attached to the center of it that we use to instill a prescribed fluid. So to apply this, it's going to go on just like our other port pad. So again, I'm checking my hole sizes, and we see that these two holes are the same size. We still peel off the back, use our wings to apply that over the hole. Again, we press everything down to make sure that when we peel these off, it remains intact. And then the handles come out from underneath. So now that this is in place, it's going to be the same connection as a regular port pad. Put the ends together, do a 3/4 turn, finger tight. Ensure that your clamps are open, and you see that dressing suck right down. Now, when we're ready to instill the prescribed fluid, we have it drawn up in our syringe. We're going to close our clamps, power down the device. Now, using our lumen, we connect the ends together, and I just slowly press in my prescribed fluid. After we have waited the prescribed amount of time, we can now resume therapy. And we do that by opening up our clamps and powering the device back on. And then the fluid that we instilled gets pulled from the dressing and into the canister.